10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Good morning, doctors, guests, colleagues, and the entire Ramsay Simadarbi healthcare family, whom we admire in both Indonesia and Malaysia. First and foremost, allow me to introduce myself. I'm Dr. Veronica Landi Davida, today's MC, and I will guide you through the session. Assalamualaikum warahmatullahi wabarakatuh, salam sejahtera, Om Swastiastu, Namo Buddhaya, salam kebajikan. Welcome to our event, Empowering Liver Wellness, Uniting Against Hepatitis and Liver Cancer. It's a cross-regional hybrid talk by Ramsay Simadarbi Healthcare. The event is a collaboration of 3 hospitals allied with Ramsay Simadarbi Healthcare, Rumah Sakit Premier Jatinegara from Indonesia, Ara Dharmansara Medical Center, and Subang Jaya Medical Center from Malaysia. This hybrid talk is being hosted in conjunction with World Hepatitis Day, which is observed annually on July 28 and brings the world together under a single theme, to raise awareness of the global burden of viral hepatitis and influence real change. This year's theme is "We're Not Waiting." The call to action is to accelerate the elimination efforts of viral hepatitis now and the urgent need for testing and treatment for the real people who need it. Along with that, this day we brought you our doctors from Ara Dharmansara Medical Center Malaysia, Dr. Prabjot Singh Sidhu, lose weight and treat fatty liver, introducing the intragastric balloon. From Rumah Sakit Premier Jatinegara, Indonesia, Dr. Muhammad Julwan Pribadi, awareness for hepatitis B infection. From Subang Jaya Medical Center Malaysia, Dr. Martin Meller Abdullah, liver cancer and its treatment available in Subang Jaya Medical Center. Before we go into the next session, let's watch a video from Ramsay Simadarbi Healthcare. To open the event, we are going to listen the opening remarks from Dato Dr. Jacob Thomas. He is a group medical advisor for Ramsay Sime Darby Healthcare. Please welcome Dato Dr. Jacob Thomas.
Thank you, Dr. Veronica Davida from Rumah Sakit Premier Jatinegara. Very good morning to you. Good morning to you, ladies and gentlemen. Dr. Hartono Tanto, the COO of Hello, can you hear me?
Yes.
Okay, sorry, it got cut off in between. Sorry, I had to reboot and come back. I just want to address Dr. Hartono, Dr. Susan, Dr. Mata, Puan Miranda, Mr. Brian Lin, and also greet Dr. Mohammad Zulwan Pribadi, Dr. Prabjot Singh, Dr. Martin Mello, Dr. Sharmila, the Director of Medical Services from ADMC, my respected guests, and ladies and gentlemen. Now, thank you to the organizers for asking me to say a few words. World Hepatitis Day, recognized every year on this day, the 28th of July, it provides an opportunity to raise awareness of the global burden of viral hepatitis infection. Every year, there are millions of lives lost due to viral hepatitis. And this has been a silent killer, as many are asymptomatic until it reaches the advanced stage, which is then accompanied by serious complications and resulting is decreased patient quality of life. Therefore, screening at regular intervals and practicing prevention measures will definitely aid in preventing an occurrence of liver diseases respectively. The low coverage of testing and treatment is the most important gap to be addressed in order to achieve global elimination goals by 2030. This year, the World Hepatitis Day theme, One Life, One Liver, creates an awareness in the public by emphasizing the need for prevention, early detection, and adherence to prescribed treatment. Although I have seen and known in my years of practice that the liver is a fantastic organ and has the capability of regenerating itself many, many times, even after liver surgery or resection of the liver, we see the liver regenerating. In addition to stressing the governing authorities to quicken the pace of necessary steps to eradicate viral hepatitis by maintaining healthy liver and meeting the global target needs, we need to do much more. Viral hepatitis infection is still one of the major problems in the world. However, and fortunately, it is still one of the most preventable diseases too. That is why a webinar like this for the public and for our staff and delivered by our doctors is so vital, and for us to be able to spread the word around that this is a preventable disease. Today, Ramsay Samdabi Group, with initiatives from 3 of our hospitals, takes the initiative to be part of this movement around the world. With our medical experts throughout all the hospitals in our chain globally, we will provide everything that the public need to know about viral hepatitis infections. From the situation of the case globally, the root cause of the hepatitis, its treatment, advanced treatment options available nowadays. All this will be discussed by our speakers and the people conducting this webinar. Thank you to the organizers for putting together this most significant hybrid talk, which will go a long way to create awareness of viral hepatitis in our hospitals among the staff and doctors, and also the communities that we serve. I want to congratulate the organizers led by Dr. Livina and the team from our 3 hospitals, a panel of doctors, for your participation and involvement in this. So, ladies and gentlemen, I just want to congratulate all those who have joined in and say this is very, very important. It's not just for us to listen, but also for us to spread the word around about viral hepatitis and how it can be prevented, and if we are subjected to that infection, how we can address it at an early stage. So before the sequelae of hepatitis sets in our liver, which is a great organ but most essential for our good and effective life that we live. So once again, congratulations to the hospitals which are taking part. Thank you to the speakers, and well done to the organizers, and have a good webinar. Thank you.
Thank you very much, Dato Dr. Jacob Thomas. Continuing this, let us hear Dr. Levina Afisa, Operation Manager of Rumah Sakit Premier Jatinegara. She speaks about the global hepatitis epidemic. Please, Dr. Levina Afisa.
Hi everyone, good morning and greetings from Rumah Sakit Premier Jatinegara, Indonesia. Once again, welcome, and I'm really glad to have you all joining us today, online or even offline, in our first cross-regional hybrid webinar from Ramsay Samdarbi Healthcare Hospital Group, Malaysia, Indonesia. Well, today, speaking of addressing hepatitis problem all around the world, as mentioned before in the World Hepatitis Summit 2022, with a specific highlight on the urgency to eliminate hepatitis virus. Because as far as we can remember, back in that year, we have an unexplained hepatitis virus infection in children that is increasing significantly globally. And unfortunately, until today, the hepatitis virus infection is still one of the major public health problems in the world. Every year, World Health Organization, working along with the global coalitions or global movement against hepatitis everywhere around the world, they are reviewing progress. They are renewing their commitments on the acceleration actions combating these hepatitis virus infections because they want to achieve the standard that they have set, which is the world free from hepatitis by 2030. What do you think, everybody? Is that even possible? Because as a global picture from all the data that we have nowadays, it's over than 350 million of people in the world now are actually living with an active hepatitis viral infections. And every year, over than 1 million people are losing their life because of condition that is related to an acute hepatitis infections or a chronic hepatitis B and C infection that is leading to a liver cancer and cirrhosis. The complexities of hepatitis disease is actually lies in the existences of different types of the virus itself. As we all know, that hepatitis A and E, they are foodborne and waterborne. And this type is really causing 1 million cases of acute hepatitis infection all over the years. While hepatitis B, C, and D, they are spreading in so many ways, from receiving unscreened blood or other blood products, sexual contact, even mother-to-children transmission during birth, and so many more. Later, we will hear about that from our medical experts that will speak today in these webinars. But, however, the hepatitis B and C, they have a greater health burden and greater mortality rate because this type is really leading to liver cancers and cirrhosis in the end. Speaking of liver cancer, liver cell carcinoma is now ranked as the 4th leading cause of death of cancer worldwide, and it is the 6th most common cancer in the world. And in fact, the incidence of liver cancer in male patients in Southeast Asia only is the 2nd highest around the world. So that is the big picture of hepatitis problem around the world. In conclusion, hepatitis virus infections is one of the most devastating diseases on earth. But it is also one of the most preventable and treatable disease with the available medical experts, vaccinations, effective medical treatments, and even advanced treatment that is available nowadays, even in our facility. We are not waiting is the theme of World Hepatitis Day 2023. It is actually a call to actions to accelerate efforts combating these hepatitis viral infections everywhere. And today, as part of RSPJ Sandarbi Healthcare Hospital Group, Malaysia, Indonesia, Rumah Sakit Premier Jatinegara, Ara Damansara Medical Center, and Subang Jaya Medical Center, we would like to take part in that effort. Providing to you today our medical experts that will share their knowledge about hepatitis virus infections, will address what is the root cause of hepatitis, what is the risk factor, what is the predisposing factors, how is the treatment, and what is the advanced treatment available nowadays, especially the one that is available in our facility. And lastly, on behalf of all our respective leaders of the hospital group, Malaysia and Indonesia, we really hope that this webinar will be an aligned activities to increase the awareness of hepatitis viral infections, will enriches our knowledge about it, and at the end will increase also the global awareness to change because the hepatitis cannot wait. So once again, happy World Hepatitis Day 2023. Sit back and relax and enjoy the whole webinar because this webinar will be interesting. I'm Dr. Vivi from Premier Jatinegara, Indonesia. Thank you very much.
Thank you for your kind words and support, Dr. Levina Afisa. Okay, I won't linger any longer. Let's get started to the main session. First, we focus on the explanation provided by Ara Damansara Medical Center in Malaysia. Dr. Prabjot Singh Sidhu as a speaker, and Dr. Sarmila Baskaran will serve as moderator. Hi, Dr. Sarmila. Are you ready to start the session, Dr. Sarmila?
You're muted, Sharmila.
Can you hear me?
Yes.
All right.
There's an
Okay.
echo.
Okay.
Okay. Are you ready to
Okay,
start the
all right.
session, Dr.
Okay, good
Sarmila?
morning, everybody.
Okay.
It gives me great pleasure to start the ball rolling on our webinar today. Good morning to my esteemed colleagues across the 7 hospitals of Ramsay Sime Darby, and ladies and gentlemen. I think it's very clear from what Dr. Jacob and Dr. Vivi have said that the liver is a very, very important organ in our body. In fact, it is the second largest organ in our body, and a healthy liver is essential for a healthy life, right? And currently in developing and developed countries across the world, something which is affecting everybody is something called metabolic syndrome, which is a myriad of symptoms led by diabetes, hypertension, high cholesterol, obesity, and this always affects the liver as well. And what we see is fatty liver, non-alcoholic fatty liver is associated with metabolic syndrome up to 70%. Okay, and non-alcoholic fatty liver actually can lead to cirrhosis and liver damage after that. So to talk more about this, we have Dr. Prabjot Singh from Ara Damansara Medical Center. Dr. Prabjot is a British-trained gastroenterologist, hepatologist, and physician with vast experience in his field. He graduated with his medical degree in 2002 from Leeds, UK, and went on to get his MRCP and followed by his MRCP in gastro in 2012 from the Royal College of Physicians. With over 14 years of practice in UK, working in secondary, tertiary, and regional referral centers across the country, from Leeds to London to Oxford, Dr. Prabjot finally decided to come home, which is very good for us, because he joined Ara Damansara Medical Center about 5 years ago, and he has grown his practice here in Malaysia since. He's a very passionate person about his field of medicine, and he's passionate about advanced endoscopy, nutrition, hepatology, and transplant medicine. So without further ado, I would like Dr. Prabjot to share his knowledge on fatty liver and how to treat it. And just a little housekeeping comment before we start. If you have any questions, you can type it into the chat box and we'll address it after the session. Yeah, thank you. Over to you, Dr. Prabjot.
Okay. Hi, Dr. Shamila. Thanks for your kind words. I hope you can hear me clearly. If it's not clear, let me know. If I'm talking too fast, let me know. I have a tendency to do that. Just slow me down, stop me whenever. It's absolutely fine. I know it's World Hepatitis Day, but I do, everybody knows about viral hepatitis. Yes, it is important, but hepatitis as a whole is a problem, a big problem. And as you're saying about fatty liver, well, Malaysia is the fattest in the whole Southeast Asia. We have more obese people than anyone else in Southeast Asia. And that comes with its own share of problems leading to hepatitis. Now, not exactly viral hepatitis, but hepatitis indeed. And because it's such a big problem, we need to do something about it. And well, this is what I'm going to cover. So let's go ahead with the talk. But yet again, if there's anything anybody wants to ask in between, whatever, just stop me and we'll take it from there. Okay. Right. Can you see my screen that I'm sharing? Hello?
Yes, we can.
Okay,
Prabjot.
sorry, I just needed to see that. Yeah, okay, thanks. Right, okay, so what I'm going to talk about is lose weight and treat your fatty liver, introducing the intragastric balloon. Some of you may already be familiar with this, some not at all, never heard of it. It is useful, and we're not just talking about weight loss, we are talking about hepatitis. Now, of course, that's my background there. I also have a website that is just purely for education and awareness for the public, for doctors, anyone else, and also a contact number if anyone has any questions. This is in addition to what ARA already does. So let's get going. Let's go there. Right, so this might change your life. Hepatitis. I figure before we start, we should define what it means. So it essentially means inflammation of the liver of any method, any source, any origin, viral, anything, drugs, whatever. It just means inflammation. So the cause, there are many causes. Immune cells in the body attacking the liver, infections, as we know, hepatitis A, B, C are the commonest. I mean, D, E is there as well. Bacteria and parasites definitely cause liver inflammation. Liver damage from alcohol, poisons, and let's not forget certain teas which everybody likes to drink nowadays can, and I've seen people end up in liver failure because of having traditional teas at large amounts, or for example, even green tea in high doses has led to liver transplant. Low doses actually is good for you, but that's for another talk. Medicines such as Panadol, paracetamol, overdose, once you've overdone it, it can kill you, and it can kill you over a week slowly. So it's a very slow, painful process. I've seen many patients with that as well. And of course, we're talking about non-alcohol fatty liver disease. And I'll refer to it as NAFLD moving forward. Of course, the label has changed a little bit now to metabolic liver disease, metabolic non-alcohol liver disease. There are many terms for it. It still means the same thing. And of course, there are other causes for hepatitis, cystic fibrosis, hemochromatosis, Wilson's disease, toxic mushrooms, and so on and so forth. There are so many. So NAFLD, which again is fatty liver. So what if you have a bit fatty liver, right? I'm sure everybody knows someone with a fatty liver and, well, they look fine, they feel fine, they have no symptoms. So what, right? Well, some individuals with fatty liver can develop steatohepatitis, which is inflammation liver, an aggressive form of fatty liver, which is marked by liver inflammation and may progress to cirrhosis and liver failure equates to death. If a person consumes this, consumes level of alcohol daily, as in high doses of alcohol, they progress to cirrhosis 10 to 12 years on average. But people with fatty liver who develop NASH get cirrhosis in 3 to 6 years. That is far faster than any alcoholic. Now, alcoholic, you can see them drinking, they know they're doing harm. Well, someone who's overweight perhaps have no symptoms, they do not know it's happening. Unless you've had some specialist blood test or an ultrasound, you don't even know you have it. And most people have. I'm almost certain more than half the people on this talk have a fatty liver, whether they know it or not. There are multiple factors that do contribute, the main thing being diabetes. So, what are the causes of this fatty liver and NASH? Well, effectively, the main thing here is being overweight and being obese. Insulin resistance, again, tends to happen when you are more overweight. Your cells become resistant to the insulin production, your normal insulin production. High blood sugars, including pre-diabetes, and the level of fats, because these fats, in a very simplistic way, block up your cells from using the insulin that your body produces. Right, so who gets this? Now the risk factors, although I said the causes are this, risk factors of a fatty liver are many as well. And this is not an exhaustive list in any way. So for fatty liver, a high cholesterol, triglycerides, having a metabolic syndrome, being obese, especially when it's concentrated over the abdomen. So if you were to compare someone who's generally overweight, but the fat is distributed all over the body, that is far healthier than a slim guy with a big belly. Polycystic, sleep apnea, type 2 diabetes, underactive thyroid, underactive pituitary gland. And for NASH, it's more likely in people who are older, people with diabetes, and again, fat concentration in the abdominal area. Now, the old way of looking at it is, or a very simplistic way of looking at fatty liver is that you pretty much need 2 out of these 5 things to have a fatty liver. And what the 5 things, I haven't listed it here, but if you either gain weight too fast, you lose weight too fast, you have high blood pressure, high cholesterol, or diabetes, just 2 of these things, almost certainly your ultrasound will show a fatty liver. That's something to keep in mind if any of you have any of these 5 mentioned facts. So, lose some weight, right? And then you keep away fatty liver, you don't progress to NASH, you don't die because your liver is cirrhotic. Easier said than done. It's not so easy to lose weight. That's a common complaint I get from patients. Whatever type of patients I see, always the consultation ends with, "Doctor, how can I lose weight?" You know, it's a common question. So what options are there? Really, it's divided into 4 parts. 1, diet and exercise, which nobody likes to hear. Mind you, the most important thing to take from this is that diet is 70%, meaning eating correctly, not eating less, eating the right type of food. Exercise is only 30%. And the best exercise is, of course, weightlifting, including for women, not just running. That burns more fat, right? You want to be focusing on fat loss rather than just weight loss. Option number 2, pills and injections. Pills, weight loss pills that are approved, not stuff you get from a friend or on the internet. Things like Rybelsus, and injections, things like Ozempic, which is primarily for diabetics. And the third option, which we're going to come to in a minute, and then the fourth, which is a bit excessive in my book, but some people do need it, is surgery, bariatric surgery. But don't forget, that is surgery, it is high risk, it is big operations, it is non-reversible. As a physician, I think if we can keep you away from the surgeon's knife, you know, although they are very good, you know, we would rather not operate on you if possible. So what's number 3? Well, it's the intragastric balloon, which I'm sure some of you already know. And if you don't, we'll try and touch on or introduce you to the idea of this. So this is a little cartoon I put together yesterday. So obesity, insulin resistance, high blood sugars, triglycerides leads to a fatty liver, leads to steatohepatitis, meaning hepatitis, fibrosis, liver becoming hard, cirrhosis, which the liver is gone, and then either cancer or death. So the intragastric balloon can stop you progressing from this, even from here to there, and even preventing to fibrosis. Something simple enough that acts as a treatment or prevention to liver disease, and also helps you lose some weight. So what is the intragastric balloon? It's basically, intragastric balloon is a weight loss procedure that involves placing a saline fill, which is basically salt water, silicone balloon in your stomach. It helps you lose weight by limiting how much you can eat, and also you feel full much faster. Procedure may be an option for people who are trying to lose weight, and diet and exercise haven't really worked for various reasons. For example, people who have knee problems, they can't really exercise as much. What options do you have? And surprisingly, even people with knee problems or knee pains, once they lose the weight via the balloon, the knee pains disappear, and then lo and behold, they can exercise. So it's not, it's a good way to start, or an option to start. And this is a nice picture of a balloon going in the stomach, inflating, and it sits in the top of the stomach, and this little shadow there of someone's obese becoming slim. Nice cartoons. Right, so IGB, intragastric balloon, options and differences available in Malaysia. Now, there are many types of different balloons all over the world. These are the 2 to be used, and I will tell you the differences. So that's a spelling error. It's supposed to be a Lurian soluble gastric balloon and a SPAS-3 adjustable gastric balloon. What's the difference? Well, I'll tell you in detail in a minute. A Lurian soluble one, it starts with this little pill in your hand and grows to this big in your stomach. That's about 550 mils. And the SPAS-3 balloon is as such. So the Lurian soluble gastric balloon. This nice picture here is for a comparison of how small it is to how big it gets. It's essentially, you swallow a pill and the water inflates the balloon, and that's it. You swallow the pill, you go and take an X-ray, You come back, we fill up the balloon with the little tubing connected to the pill. Takes only 3 minutes. Second X-ray to double check position and then disconnect. That's it. X-ray check position. The whole process literally takes 10 minutes. I literally put a stopwatch there and tell patients, look, if you don't believe me, this is what we do. And yes, 10 minutes, that's all it does. There's no endoscopy, nothing going down, no cameras, nothing. Okay. The balloon stays in your stomach for 4 months. It deflates by itself. There's a little stitch there that will break down the gastric acid over the 16-week period, and the balloon deflates, water comes out, and when you go to the toilet, it comes out by itself. Sometimes people don't even know it's passed. You lose between 10 and 15% of your starting body weight. That's pretty good. So it doesn't give you a fixed number, it depends on what you are. In addition to this, the Lurian system or the company provides you a dietitian support for 12 months. See, the balloon only stays there for 4 months, but to prevent the weight coming back on, in fact, a lot of people continue to lose weight, the dietitian is there as a good support system. So success rate is quite good in the 90%, even though balloon's only there for 4 months. So that's the Lurian swivel gastric balloon. The next one is the SPAS-3 adjustable gastric balloon. Now, this is a bit different. One, it can stay in your stomach for 12 months, not just 4 months. So that's good, isn't it? Longer time there, get your money's worth, I guess. You can lose up to 20 kilograms. That's a lot, but it's a different way of presenting it. That was a percentage, this is a fixed number. After 4 months, the balloon size can be increased. That's why it's an adjustable balloon. Because after 4 months, your weight loss tends to plateau, and this will enhance it. So it's like almost having a second balloon in there. The only thing is that you need endoscopy to place it down. You need endoscopy to increase the size and endoscopy to remove the balloon. Even so, it only requires daycare. You don't need to stay in hospital overnight. And the insertion of a balloon only takes 15 minutes. So it is very, very, very fast as well. So you have options. Effectively, you're going from here, you put the balloon, you get to there, maybe. But more importantly, since it's World Hepatitis Day, you go from here to a healthy liver simply by losing weight, the weight that you all know you should be losing, but maybe need some help. Now, it's very important to remember that you can't just put a balloon in and then go and eat all the junk food you want. No, everything is an adjunct. You have to put in some effort. That's why the dietitian is there for the first balloon. The second one doesn't really have that. And it's part of a healthy lifestyle. But that little help that gets you on the right path, moving along. We just put a balloon in last week, one patient, and in a week she's lost 4 kilograms very fast. Another one in 4 months she lost 20 kilograms for the Lurian balloon. So it does vary and everybody's different, but it is also based on patient's motivation. If you just went and ate junk food non-stop, yeah, of course you'll lose weight, but not as much as you would if you had a good healthy lifestyle, eat properly, follow advice, do exercise. They encourage good exercise. And before you ask, because I know everybody asked me the thing, will the balloon burst in the stomach? No. I weigh 85 kilograms. I've stood on one of these balloons and it did not burst. It is very strong. You can go diving, you can go on flights with these things. And it's great, isn't it? The only thing you feel is like, oh, look, something's there in your stomach. And then you lose the weight. And that sorts out your liver problems. So, thank you. Now, this is just an introduction. I'm sure you have many questions. You can, of course, get in touch with Ara Damansara, or you can just WhatsApp me. Don't call, just WhatsApp, and I'll help you as much as I can. That's me. Thank you.
Thank you, Dr. Prabjot. I would like, okay, in the chat box, that's a very informative talk that was given by Dr. Prabjot just now. And I have, at the moment, 2 questions here in the chat box. The first question is, what's the effect if fatty liver patients consume atorvastatin irregularly?
Okay, so there's a lot of studies to show that atorvastatin is actually good for you. Now a statin, yes, everybody knows, will irritate your liver and cause it to go up. But within certain limits, it is fine. The thing is this, you are addressing one of the factors of fatty liver, which is the cholesterol. It is good. We also know now that statins have a protective effect, I mean, as well as the heart because of the anti-inflammatory effect, but also on the liver. So if you took a atorvastatin and it goes up a little bit, as in your liver function, you can test it to see if it is the drug or not by simply stopping it. But if it went up within, just marginally go up, I would not stop it. I think as a whole, the atorvastatin is a good thing for the liver. But I'm the kind of person that always likes to deal with the root cause. Now, if your cholesterol is up because of poor diet, sort out your diet. If it's because of genetic element and you can't do anything about it, then yes, of course it's useful. Now, I mean, there's many things out there, even food. We all know about black seed or Nigella sativa, which is natural foods that can help reduce your cholesterol as well, almost as good as a statin. This is study proven, not made up. So removing the junk food, getting rid of processed food, getting rid of oils, fats, and sugars, certain oils, and increasing your plants will change your trajectory of your health and even your liver disease. There are plenty of foods out there now. Don't eat as natural food as possible. Don't have it processed. That is definitely the way forward. A statin is good for your liver if it doesn't cause too much inflammation to it, but it does address one of the causes of fatty liver. So yes, I would not stop a person on it. Carry on, of course.
Thank you, Dr. Prabjot. The next question is, could fasting reduce the risk of fatty liver disease?
Okay, so
I think they probably are talking about intermittent fasting.
Yeah, so it's interesting, right? Now, fasting, so our human bodies are made up such that it has a different function in the daytime and the nighttime. Effectively, the only type of intermittent fasting that you really should know about is just do not eat when there is no sunshine. Your body does a different thing at night. Except we are modern people and we like to eat food at 10 o'clock at night. That's the wrong thing to do. Now, what you're doing by doing this is letting your body, your gut microbiota work the correct way, and that does help your liver with reducing weight and reducing stress and all doing that. But also the fasting itself does. Now, fasting is not appropriate for everybody. For example, if you have gastritis, fasting is the last thing you should be doing. But yes, it can help. But that's if you want to lose weight, fasting, just intermittent fasting alone can help, but is not the only thing. There are many, many, many different things. I would say always go down to the pure basics and look what you're eating. Make sure there's nothing processed there. I tell people don't have sugar. They keep telling me, oh, well, can I have honey? No, honey is sugar as far as I'm concerned. Oh, I'll have some sweetener. Well, sweetener is processed, so you shouldn't even be having that. Just look at your diet is always the first thing. All these ideas of intermittent fasting and all that should be an add-on, but always go back down to your diet. And majority of the time, not too long ago, I just advised an 18-year-old boy who developed fatty liver, abnormal liver function, diabetes. He was a bit overweight. And just by simple dietary advice, he lost 20 kgs in 3 months. No medicines. All his disease disappeared. His cholesterol normalized, his liver function normalized, his diabetes label was taken off. Absolutely fine. So those things can be achieved. You can reverse disease just by changing what you eat. That is even before you start intermittent fasting. But yes, fasting means you're not eating. Yeah, as a whole, you're eating less calories. Of course, it will help.
Thank you. We have 3 more short questions from the same participant.
Yeah.
One is how to put the balloon in through operation or colonoscopy. The second is how long does the procedure take? And the third is any side effects.
Okay, so the first balloon, a Lurian balloon, as I explained before, it's basically you swallow it, X-ray to check position, inflate the balloon via a little tubing that's connected to the pill, takes literally 3 minutes, and then a second X-ray to check position again. The whole thing takes 10 minutes, no endoscopy, nothing whatsoever. The second balloon requires an endoscopy to put it down, and it takes only 15 minutes. And why 15 minutes? Because we have to inflate the balloon as well. It takes time. As to any side effects, well, you feel full. You don't feel hungry. For the first few days, you might feel nausea, maybe some cramping, but we give some medicines for you to take for a few days, simply because the body is adjusting to a fact there is something that is almost 2 cans of Coke in your stomach. It's 550 mils. It's quite a lot. So your body will take a couple of days to adjust. But that's why the first week we give you good medicines. The first week you will have more of a liquidy based kind of diet. At the end of the week, you'll be eating solids again. And the dietitian input is very important because you're limited to how much you can eat. You must eat nutritious food. You cannot just eat junk food. You get malnourished. That's not the point of this. And that's essentially it.
Dr. Prabjot, if I could ask a couple of
Sure.
questions. Is there any suitability criteria, like eligibility criteria for patients to get this intragastric balloon?
So, ideally is anyone between the BMI of 25 or 27 to up to about 40. Beyond 40, surgery will give you a bigger result. But in some people, surgery is not safe. You put the balloon in to bring the BMI down and then you repeat it. So there's no real upper limit per se. Now, the things that I advise not to do is that you shouldn't be having anything corrosive as medication-wise. So if you want Plavix, for example, it irritates the stomach. Don't, because you're going to put a gastric balloon there that can potentially irritate the stomach. If you have gastritis, get it treated first, then you can have it. But the main thing you should not have had done is any surgery to your stomach or your esophagus, because it does affect the position of the balloon. We want this to be a safe, good, and fun experience rather than something that causes you problem. But that's it. That's essentially it. Now, when I say about traveling and flights and things like that, you can go on flights. It doesn't do anything. But of course, the Allurium balloon means that if anything was to happen to the balloon, it comes out through your GI tract, you're fine. The other one, if anything goes wrong with the balloon, though it never really happens, you will need to see a doctor in wherever country you are. So maybe you would have to think a bit more before you took the second one if you were to travel. But apart from that, no, it's fairly straightforward, no problems whatsoever. And only a month ago, we had 3 patients, family members just lining up, videoing each other putting in the balloon. That's how comfortable, how much fun they have with this, and they're on their way.
Thank you. Okay, there's another question in the chat box. When should a hepatitis B carrier patient do a Hep B DNA load test? And is the patient Hep B positive for 30 years?
Do it now. Do it yesterday.
Hepatitis B positive for 30 years.
Yeah. So if you got hepatitis B, you need a baseline check. It's very clear guidelines what you need at the very beginning. You need your DNA load. You need to check your cancer marker. You need your ultrasound and a fibroscan. You need to make sure you don't have HIV. Your thyroid functions fine. Hepatitis C as well. And you get a good, nice, clear baseline. When you got the baseline, there's very clear guidelines to say whether you need treatment or not. Because for hepatitis, it's very interesting. Hepatitis B, your body keeps it in control. You can never get rid of it as it stands because it's a DNA virus. And if you lose control, that's when you need medicine. And there are very clear criteria based on age, how high your DNA load is, and the state of your liver that will dictate. And very often, one reading alone is not enough to say you need medicines. You will need 2 readings about 3 months apart. So if you haven't had your DNA load, you haven't had ultrasound, you haven't had your hepatitis C, because you can get co-infections, D as well, that B and D goes together. Go and get your baseline done yesterday, not even today, yesterday. You should have done it. And then whatever it is, in most countries, you need to be followed up by your hepatologist every 6 months, but ideally every 4 months. And now your follow-up may very well be just a simple blood test. Hi, bye, you're okay, feeling well, everything's fine, go. But annually, every year, you will need minimum an ultrasound, minimum the DNA load, and your cancer marker check. And that's for hepatitis B, even if you feel well. So if you haven't had this thing done, do it now. So what are you waiting for? I mean, you've had it for 30 years. Clearly you're doing well, but you can never know. Your body could lose control of this virus at any point. It may gain back control, but every time you lose control, it causes irreversible damage to your liver. Don't forget, with hepatitis B, it increases the chance of liver cancer, not by 100%, by 100 times. Okay, so it's not a joke. And what we do with hepatitis B is to keep cancer away from you, rather than trying to keep monitor the liver function. We want to keep the cancers away from you. I hope that helps.
Thank you. I don't see any more questions in the box. Does anyone have any other questions? Would just like to voice out if they want to? Okay, in that case, I think I will end the session by a take-home message, actually, which is the world can't wait, which is actually the theme for the World Hepatitis Day 2023. The world can't wait. Accelerate elimination efforts, urgent testing, urgent treatment. That is the way to go to eliminate hepatitis in the world, okay, and to stop this disease from progressing further. Before we end the session, I'd like to share a video which from R. Damansara Medical Center, just for you all to have a look. Thank you. Thank you very much.
Thank you, Dr. Sharmila, for guiding us, and thank you, Dr. Prajo, for sharing the material. Thank you very much from Ara Damansara Medical Center. Okay, we'll move to the next session. Now we'll listen to the presentation from Rumah Sakit Premier Jatinegara, Dr. Muhammad Julwan Pribadi as speaker, and Dr. Catherine Josephine will serve as moderator. Please welcome Dr. Muhammad Julwan Pribadi and Dr. Catherine Josephine.
Thank you very much, Dr. Veronica. Assalamualaikum warahmatullahi wabarakatuh. Good morning for all our colleagues from Ramsay Samdarbi Healthcare Group. Thank you for all participants who have joined us in our meeting. My name is Catherine Josephine. I am a general practitioner here at Rumah Sakit Premier Jatinegara, Indonesia. And I am honored to be your moderator for the second session. So if previously Dr. Prabjot from Aram Damansara Medical Center has already explained to us about fatty liver and the innovative way how we can prevent it. The next topic here will be more about viral hepatitis. Viral hepatitis, especially hepatitis B, is the world's most common infection in the liver that is very serious in the long run if we don't treat it as soon as possible and if we don't screen it in time. So to explain to us further about hepatitis B, I will invite Dr. Muhammad Julwan Pribadi. He has been an expert in his field for 10 years. And he graduated from a medical degree from Universitas Indonesia, and he has joined Premier Jatinegara Hospital since 2006, and then he became an expert in gastrohepatologist since 2013. So he has more than 10 years of expertise in this field. But before we go to Dr. Muhammad Julwan Pribadi, we will watch a video about Premier Jatinegara Hospital. Okay, so before we move on to the next session from Dr. Julwan, I would like to remind all the participants that all questions can be put in the chat box and will be answered and discussed after the session, the speaker session. So without further ado, I would like to welcome Dr. Muhammad Julwan Pribadi to the stage. The time and place is yours. So, Dr. Julwan, good morning.
Good
Thank
morning.
you for coming, joining us in our meeting today. So, right now we're going to speak a little bit more about hepatitis B, right, doctor?
Yes.
So, what topics, what are we going to talk more? Is it more of in the general, or what are you going to explain to the audience today?
Maybe it's kind of a general information
All right.
for a layperson.
Okay.
Lay-
So hopefully, in regards of the World Hepatitis B, the public can be more informed about hepatitis B.
I hope
right?
so.
All right,
Yes.
doctor. If you're ready, the time and place is yours.
Thank you, Dr. Catherine. Good morning, colleagues, ladies and gentlemen. First of all, I want to thank Dr. Susan, Dr. Fifi, and the organizing committee for giving me the very honored opportunity to participate in this very important event. And I prepared this presentation with my co-author, Dr. Jessica Handoyo. Give it up to Dr. Jessica. Well, ladies and gentlemen, my task today is to deliver the information about hepatitis B awareness. We have nothing to disclose for this presentation. And this is the outline of our presentation. We try to answer some questions and also bring out brief key information regarding hepatitis B infection. So the first question is, what is hepatitis? Dr. Prabjot already answered some of it. Hepatitis means inflammation of the liver. The suffix itis means inflammation, and hepa means liver. Most commonly caused by infection with one of 5 viruses: hepatitis A, B, C, D, or E. And hepatitis B is a specific type of hepatitis that is caused by hepatitis B virus, commonly abbreviated as HBV. It is the world's most common serious liver infection and is highly infectious. How common is hepatitis B? Worldwide, World Health Organization, WHO, estimates that 296 million people were living with chronic hepatitis B infection in 2019, with 1.5 million new infections each year and over 800,000 dying annually from hepatitis B-related liver disease. And medium to high infection rates can be found in South Asia, our region, the Middle East and Far East, Southern Europe, and Africa. This world map shows the areas that has already been mentioned. And if we see the grading of color from yellow to red, it means that these countries have more than 2% prevalence to more than 8% prevalence. What about our region? Indonesia, along with Myanmar and Papua New Guinea, is grouped in countries with intermediate prevalence, 5 to 9.9% prevalence. Whereas Philippines, Timor-Leste has high prevalence, more than 8%. And Malaysia, Singapore, Thailand, and Laos has low intermediate prevalence, 2 to 4.9%. And Australia has low prevalence, less than 1 to 1.9%. And Brunei, we don't know yet because there is no data yet. In Indonesia, the proportion of people living with hepatitis B in healthy population is estimated to be 4 to 20%. This chart shows the proportion of hepatitis B positivity during across age groups, with a higher proportion living outside of Java than on the island. In 2013, Basic Health Research, Riset Kesehatan Dasar or Riskesdas, discovered at 7.1% positive HBsAg proportion. This means 18 million people in Indonesia is infected by hepatitis B. This is a very big number. But the next question is, are we aware of the problem? Because CDC, United States CDC, Centers for Disease Control and Prevention, found that more than 2/3 of people living with hepatitis B infection might be unaware of their infection. And this chart shows that among persons with HBV infections, only 15% aware of HBV infection. So more than 80% are not aware of their infection. So this is a very big gap to fill in. And to reach the goal of eliminating hepatitis B infection, this is a very big task to be tackled. So to tackle this task, first of all, we have to know the virus itself, the characteristics of the virus. This is the hepatitis B virus. It's a spherical virus. The size is 42 nanomillimeter. And the parts of the virus will be identified by our immune system as antigen. This outer part is the envelope, or called surface part. So it will be the surface antigen, or usually abbreviated to S antigen. And inside the envelope, we can find the core, which is identified as a core antigen or C antigen. And inside the core, we can find the genetic material of the HBV, the HBV DNA. Now, if somebody is infected by HBV, the virus eventually will find its way to our liver cells, and then it will go even deeper into the nucleus of the cell. Then the genetic material will act as a template to produce copies, a lot of copies of themselves. So they will produce the virus, the complete virus with the DNA, and also the empty envelope, which is called the S antigen, and also another antigen called E antigen. So these particles can be seen through electron microscope, and the appearance is like this. This is the complete virus, and this is the S antigen. After a person is first infected with hepatitis B, they are said to have acute hepatitis. But most people with acute hepatitis B recover uneventfully. Chronic hepatitis B occurs when the body cannot get rid of the virus and it remains in the blood for more than 6 months. So the cutoff time is 6 months. The likelihood of developing chronic hepatitis B largely depends on your age at the time of infection. Chronic infection develops in about 90% of children who are infected at birth. In 20 to 50% of children who are infected between the age of 1 and 5 years, and less than 5% of people infected with hepatitis B during adulthood. The following change may occur in the liver of people with chronic hepatitis B infection. First, fibrosis can form. Fibrosis is a small scar tissue is formed within the liver. So from the healthy liver to this fibrotic liver. And then as the damage from fibrosis progresses, large sections of liver can become scarred and nodules may form. As a result, blood cannot easily flow through the liver, causing the liver to shrink and harden. And about 30% of people with hepatitis B develop cirrhosis. Cirrhosis will decompensate. And if it decompensate, the liver can fail. Liver failure may occur in case of severe cirrhosis. Liver failure means that liver is unable to carry out its normal function, which can lead to death. And liver cancer is a serious complication of chronic hepatitis B infection that mainly occurs in the presence of cirrhosis. About 5 to 10% people with hepatitis B may develop liver cancer. Studies in Asia Pacific region shows that the incidence of cirrhosis is reported to be 1 to 2.4% per year, and it will regress to be decompensated in approximately 4.6% per year. And also another study shows that in general, in cirrhotic patient, 12% will develop decompensated cirrhosis and 21% will develop liver cancer, hepatocellular carcinoma. And 11% will die from liver disease. And a multi-center in Indonesia showed that 63.1% of liver cancer is caused by hepatitis B. So what are the symptoms? Hepatitis B is often called a silent infection because many people don't have any symptoms. If any symptoms are present, they are usually mild and non-specific, such as loss of appetite, nausea and vomiting, flu-like illness, fever, fatigue, ache in the right upper abdomen because this is where the liver is located, and jaundice, the yellow discoloration of eye and skin, and darkening of the urine, and lightening of the feces. For people with more advanced disease, there may be other symptoms related to the underlying liver damage, such as fluid accumulation in the belly, disturbance of consciousness, and bleeding in the digestive tract, such as vomiting blood. So, how is hepatitis B transmitted? Hepatitis B transmission can be through several mechanisms. The most important one is mother-to-child transmission because this is the mode of transmission that is most prevalent in this area, in our area. Mother-to-child transmission during childbirth. Also contact with blood or bodily fluids, including sexual contacts, sharing household objects like personal items, razors, toothbrush, or nail clipper, and use of unsterile medical tools and equipment. So, after knowing the mode of transmission, who are at risk? People with increased risk for hepatitis B virus infection. First, infants born to pregnant persons who are hepatitis B surface antigen positive. And persons born in regions with hepatitis B virus infection prevalence of more than 2%. That's us, living in this area of the world. Injection drug use, incarceration in jail, prison, or other detention setting, HIV infection, hepatitis C virus infection, men who have sex with men, sexually transmitted infection or multiple sex partners, household contacts of persons with known HPV infection, needle sharing or sexual contacts of persons with known HPV infection, maintenance dialysis, including in-center or home hemodialysis and peritoneal dialysis, elevated alanine aminotransfer or aspartate aminotransferase level of unknown origin. Alanine aminotransferase is also known as SGPT, and aspartate aminotransferase also known as SGOT. And persons who request HPV testing. So they are the ones are at risk. Now, screening needs to be done to detect as many infected people as early as possible. Why it is important? Because hepatitis B virus infection has substantial morbidity and mortality. And chronic HBV infection can be detected before the development of severe liver disease using reliable and inexpensive screening tests. Treatment for chronic hepatitis infection can reduce morbidity and mortality. Management of chronic hepatitis B infection might prevent transmission to others. Universal screening of adults is cost-effective. Screening enables identification and management of pregnant persons infected with HBV and their infants, which can reduce the risk of perinatal transmission. Screening can identify persons who are at risk for reactivation of HBV infection. Screening might identify persons who would benefit from hepatitis B vaccination. So, just recently, US CDC published a recommendation for screening. The first part is about universal hepatitis B virus screening. Hepatitis B screening at least once during a lifetime for adults aged 18 years and more. During screening, test for hepatitis B surface antigen. You may remember the surface antigen is antigen of the envelope. And then antibody to this surface antigen, anti-HBs, and total antibody to the C antigen, HBC antigen, the core antigen. So these three tests is done in the screening, in the first screening. So this is the three important tests. It is called the triple panel. Screening for pregnant persons. HBV screening for all pregnant persons during each pregnancy, preferably in the first trimester, regardless of vaccination status. And if there is no risk after first screening, next pregnancy only needs HBsAg screening. And then the risk-based testing is testing for all persons with a history of increased risk for HBV infection, regardless of age, if they might have been susceptible during the period of increased risk. And periodic testing for susceptible persons, regardless of age, with ongoing risk for exposure, while risk for exposure persists. What susceptible person means in this context is person which has not been vaccinated yet. So this is just to reiterate or repeat the detail of triple panel. So triple panel will be hepatitis B surface antigen, SBSAG antigen, this part of the antigen, this part of the virus, and the anti-HBs, anti-surface antibody to this part of the virus, and hepatitis B core antibody to this antigen, to the core antigen. Now, to establish the diagnosis, their blood test is needed to assess liver function and the amount of virus in your blood, and serology. Serology means testing for antigens and antibodies. We need to know the status of the hepatitis B and E antigen. If you remember, E antigen is one antigen that's produced during the replication of the virus, and then antibody to this antigen. And of course, we need to know the hepatitis B DNA. The HBV DNA, which is called viral load, is a measure of the concentration of the virus in the circulating blood. Other tests, many other tests that can reflect the health of the liver also needed, but they are not specific for hepatitis B, like SGOT, SGPT, and so on. Liver imaging also need to be examined, tests to use to create images of the liver by using ultrasound and fibroscan. Fibroscan is an imaging to measure the degree of fibrosis, and liver biopsy, a procedure in which a small piece of tissue is taken from the liver and examined under microscope. But nowadays, the liver biopsy is done as a last resort if the blood test and the non-invasive test is not conclusive. Also need to be done is surveillance testing for liver cancer, for hepatocellular carcinoma. It's to perform 6 monthly surveillance for HCC by hepatic ultrasound and alpha-fetoprotein. This is a tumor marker in people with significant fibrosis or cirrhosis. In people without significant fibrosis or cirrhosis, consider 6 monthly surveillance for HCC if the person is older than 30 years and has family history of HCC and HBV DNA greater or equal to 2000 IU per ml. Now, what about the treatment? Or maybe the question is, should everyone be treated? Specific treatment for acute hepatitis B is usually not needed, since in about 90% of adults, the immune system controls the infection and gets rid of the virus within about 6 months. In people who develop chronic hepatitis B, an antiviral medication, either oral or injection, might be recommended to reduce or reverse liver damage and to prevent long-term complication of hepatitis B. And about liver transplantation, in some cases, liver transplantation may be the only option for people who have developed advanced cirrhosis. For person infected with hepatitis B, it is important to prevent transmission to other person. So people with hepatitis B should discuss measures to reduce the risk of infecting close contacts. So they have to notify their household, sexual and needle sharing contacts that it should be tested for markers of hepatitis B virus. And if susceptible, contacts should be vaccinated. And to practice safe sex until their partners is vaccinated, to cover cuts and skin lesions to prevent spread of infectious secretions of blood, clean blood spills and with bleach solution, refrain from donating blood, plasma, tissue, or semen, refrain from sharing household articles like toothbrush and razors that could become contaminated with blood, refrain from sharing needles, syringe, and other injection equipment, dispose of blood, body fluids, and medical waste properly. And when seeking medical or dental care, person with HBsAg positive should inform their health provider so they can be evaluated and managed appropriately. And about prevention, hepatitis B vaccination is the mainstay of the HBV prevention efforts. We have to be grateful because there is vaccination that can prevent the hepatitis B infection. In 2018, US CDC published a recommendation for vaccination that all infants and persons up to 19 years old should be vaccinated. And people all older than 19 years old, if they have increased risk of getting infected by hepatitis B, they is offered vaccination. So the risks are the same as the one that has already mentioned before. So 19 years and older, you have to consider if there is risk or not. But that's in 2018. In 2022, the CDC update their recommendation. So everybody from infants to 59 years is recommended to have vaccination, to have hepatitis B vaccination. Risk factor is only considered for people older than 60 years. Even then, adults aged more than 60 years without non-risk factors for hepatitis B may receive hepatitis B vaccines. So the shift is towards universal hepatitis B vaccination for everybody. And to prevent infection from mother to child, special attention is given. The measure to prevent infection from mother to child will involve antiviral medications. Antiviral medication may be recommended for a mother if the amount of virus in her blood is high. Hepatitis B immunoglobulin. Infants should be given a shot soon after birth called hepatitis B immunoglobulin or HBIC. HBIC provides immediate protection to the infant, but the effect only lasts few months. So infants should also receive hepatitis B vaccine series. Completing the vaccine series is important for long-term protection. The first dose of hepatitis B vaccine should be given at birth. 2 other doses are typically required to complete the vaccine series at approximately 1 and 6 months of age. And these are few tips for maintaining liver health. Avoid alcohol and smoking, healthy diet and exercise, and if needed, please see a doctor with expertise in liver disease, usually a gastroenterologist or hepatologist who can discuss treatment options. So ladies and gentlemen, colleagues, to summarize my talk, hepatitis B is the world's most common serious liver infection and is highly infectious. Unfortunately, only less than 1/3 infected people aware of their condition. Infection in babies and young children will lead to long-term illness and may lead to cirrhosis and liver cancer. Hepatitis B infection can be prevented by immunization, and infected person can be treated by medications. Thank you very much for your attention. Back to the moderator, and I'll be glad to discuss and answer some questions. Thank you.
Thank you very much, Dr. Julwan. So we already have a few questions from the chat box. Well, first is from Subang Jaya Medical Center,
Yes.
from Amelia. So does a spouse of someone who is diagnosed with chronic hepatitis B need to do the risk-based screening? And how long is the interval? Is it every 6 months or every few months?
Well, the most important thing I see is I think the spouse has to be vaccinated if she or he is not infected yet. And if the vaccination is successful, the spouse is already protected.
Okay.
So it doesn't need to be monitored because already immune.
Okay,
Yeah.
so basically, if a spouse of someone who has chronic hepatitis B,
Yes.
First they need to do the screening one time and then get
Yes.
vaccinated
Yes.
as soon as possible.
Yes.
And after that, no more need to do the screening. Just making sure that the vaccination the immune is already enough
Yes.
to prevent the hepatitis B.
Yes.
Okay, thank you, doctor. And regarding to about vaccination, there's also a questions from the chat box. When a fully vaccinated person should take the booster? What measures we need to take to say that right now we already need the booster for the immune?
This is a question frequently asked. According to CDC, if the vaccination is successful and it means that the patient or the person respond. Actually, the vaccine can last to 30 years.
30 years.
Yes.
Okay.
And there is actually no formal recommendation for boosters.
All right.
But
Mhm.
some experts says that if you are checked for anti-HBs and then the titer is low,
Mhm.
low than 100, some experts there are some experts that recommend to have boosters.
Okay.
But CDC says that actually there is no formal or no evidence for having boosters.
Okay, so
Yes.
about the recommendation of booster is still highly debated
Yes.
between experts,
Yes.
whether you need to do the booster or not,
Yes.
and whether there's a baseline of the immune
Yes.
that you
Because
require to take.
because our memory cells, we have our immune system have memory cells.
Mhm.
Even if the titer gets low,
Mhm.
whenever there is an infection, our memory cells will boost up our immune system.
Okay,
Yes.
so it is related to the next few questions.
Yes.
So there's also another questions from Subang Jaya Medical Center from Dr. Martin Mellor. So is the seroconversion with the vaccination will be the same across the age? Like if children gets vaccinated or adults get vaccinated, will the seroconversion will be the same?
One of the reasons why people older than 60 years is not included in the
Mhm.
universal
Recommendation.
universal vaccination is one of the reasons is because it's age related.
Okay.
The older you get,
Mhm.
the lower the response.
Okay.
Although it's still more than 80%, but it's lower than if you are younger
Still
getting
younger.
vaccinated.
Okay, but
Yeah.
we may say that children and adults usually have the
Usually
same
good
rate?
response,
Okay,
yes.
but
More
not
than
different.
95%.
Okay,
Yes.
so there's no difference whether you take it as a children or adults then.
No,
Okay.
no difference.
So another questions. If is it possible if you already take the vaccine that
Yes.
you can get the hepatitis B?
Theoretically, no.
Okay.
Theoretically,
Okay.
yes.
So as long as you
You respond to the
yeah.
vaccination.
Okay.
Yes.
So it's all according to the response and of the vaccination, and
Yes.
whether you get it before maybe the vaccination, then it can seem like you get the hepatitis B after the vaccination.
Oh yeah, I mean, you mean getting the infection before the vaccination? Yes,
Yes.
that's another story.
Okay. Because since like you mentioned before that 2/3 of people don't know that.
Yeah, that's the unfortunate situation.
Okay.
Yes.
So that's why it is important to do the screening first
That's right.
before the
That's right.
vaccination.
That's
Okay.
right. Universal screening.
Oh yes.
Now the CDC is recommending universal screening. Everybody has to be screened at least once
All right.
in a lifetime.
Very good question. And after that, how about the recovery phase for acute hepatitis B? As you mentioned before,
Yeah,
you
yeah.
can categorize it into acute and chronic hepatitis
yes.
B. Will all acute cases go become chronic hepatitis B, or is the virus dormant in our body, or it is only happened to several cases?
It depends on the age you are get the infection.
Mhm.
If you are an adult, 95% the virus will be cleared.
Okay.
95%. But if you are a baby or a toddler, most of the time you will be having a chronic hepatitis B.
Mhm.
It has something to do with our immune system. So when you're adult, you have a completely working immune system. But when you are a baby, your immune system is not
Fully
complete.
developed yet.
Yes.
Mm.
So when is it defined as a chronic hepatitis B? If the virus still can be detected more than 6 months.
Okay.
Yeah. If after 6 months you can still detect the virus, you are having a chronic hepatitis B.
Okay. So by definition, it's just the length of the infection where the virus can still be detected or
Yes.
not.
Yes.
But if the patient maybe undergo treatment or the patient with good immune, usually the virus won't be detected after 6
Yes,
months.
because our immune system can clear up the virus.
Okay, doctor,
Yes.
thank you. And so we also have another questions from Indonesia. I will read it in Indonesia first and then I will translate it. Apa yang menyebabkan kondisi sehingga terjadi sirosis dan apakah seberapa kuat direkomendasi untuk melakukan pengecekan hepatitis B dan booster untuk karyawan perusahaan saat MCU? So the question is what causes the hepatitis B to become cirrhosis, and also how highly recommended it is to check hepatitis B and booster of the vaccination for companies during medical checkup.
Okay, the first one, cirrhosis happens when the infection becomes chronic. Like what has already mentioned in the presentation, if the infection becomes chronic, there can happen or occur inflammations. And inflammations, if it is repeated from time to time, can change the structure of the liver. So that can form fibrosis. And if more and more fibrosis form, the liver structure is going to be changed into cirrhosis.
Okay.
Cirrhosis means that all parts of the liver is filled with fibrosis.
Okay.
And losing the function. So the question is, when it happens when the chronic hepatitis B is not treated.
Yes. Okay.
If it is treated, one of the goals of the treatment is to prevent cirrhosis to happen. Okay. And the second
question is how important it is to do the checkup for companies for medical checkup.
Yeah, I think it's important. The recommendation for screening is once in a lifetime. But for people with risk, and I've already mentioned what are the risks, it is usually better to have repeated testing.
Okay.
Repeated testing if the risk is still there. Yeah.
So, for example, if the job or the the profession is
we are medical profession,
high
and
risk,
we don't have the protection or vaccinated, it's better check. But like I said previously, for people with risk, it is better to be vaccinated. Yeah.
Okay. And also for the booster, since like you mentioned before, the experts still debate.
Yeah, it's just a little bit.
So it is
formally there is no recommendation for boosters.
okay.
Yeah.
So it's according to the physician of the
Yes.
company, perhaps. Okay. Is there any other questions from the audience, live audience, perhaps, or any other questions from online audience? Yes, sir. You can. Can somebody help with the mic?
Thank you. Just short questions. I'm Dr. Putu Bida from Global Insurance Broker. What is the percentage of the success of using interferon in the treatment of viral hepatitis B?
First of all, I want to tell you that nowadays interferon is not used as much as as they used to be, because interferon have many side effects, and it is very uncomfortable for the patients. And now we have oral medications with a very, very good efficacy. Although the downside of the oral medication is it has to be given for a very long time. Now, but if you want to know the success, well, if we measure the success with hepatitis B S antigen seroconversion, from positive to negative, it's called a functional cure. One of the ultimate goal of treating hepatitis B is functional cure. Functional cure means that the S antigen becomes negative. So studies shows that by using interferon, we can get about 10% S antigen being negative. And this is higher than the oral medication, because oral medication only 1 to 2%. But like I said, the side effects and the comfort for the patient is not very good.
One more question. What is the minimum requirement of titer antibody to protect against us from the hepatitis viral attack?
10 IU, 10 international unit per ml.
Unit, yeah. Okay.
Yes.
Yeah. Thank you.
Thank you very much.
Thank you very much, Doctor, for the questions. And Dr. Jowan, I still have another question from the chat
Okay.
box. So Iran asked that, can a baby who has been infected with hepatitis B from his mother develop hepatitis cirrhosis? And if so, what are the advantages of giving the hepatitis vaccine at birth? So the case is the baby is delivered from a mother who is positive.
Yes.
And will the baby eventually develop hepatitis cirrhosis? And if the vaccination during birth is still beneficial for the baby?
Yes. Prevention of mother to child transmission is very important. So first of all, this question in this question, the mother is hepatitis B?
Yes.
Yes. For the hepatitis B pregnant woman, examination has to be done. I mean, it has to be thoroughly checked whether the virus is high or not. If the virus is high, the mother should be given the standard procedure, the SOP, the standard operational procedure now that is adopted even by the Ministry of Health, is given antiviral. At the third trimester until birth, at least until birth, can be continued to 1 to 3 months. This is to lower the viral load. So the lower the viral load, the lower the probability of transmission. And besides that, HB has to be given right at birth, and also the first vaccination dose. It is proven to be effective, still effective for the baby.
Okay,
Yes.
so very good information. So it is still important to give the vaccine
Yes.
to the baby even
Yes.
though the mother is
Yes.
positive
But the mother has to be checked and
Okay.
to be treated
during the
during
pregnancy.
the third trimester,
Okay, and
if needed. Yeah.
okay, so but the baby, how big the chances is to get the cirrhosis of hepatitis?
If the mother with high viral load is given antiviral, and then during birth the baby is vaccinated and giving HB, the probability to have chronic hepatitis B is very, very, very small.
Okay,
Yes.
nice to know, doctor, because it's maybe one of the concerns for the mother. Okay, so there's still a lot of questions unanswered, but maybe due to the limitation of time, we are going to conclude this session so we can proceed to the third session. But before we close this session, I would like to give a few take-home message from Dr. Julwan. So please remember that hepatitis B is the world's most common infection and is still highly very infectious. And unfortunately, only 1/3 of people are aware of their infection. And infection in babies can cause prolonged problems and long-term illness. So we have to prevent it as soon as possible with immunization. And infected people can also be treated with proper medication to prevent chronic hepatitis B. So next we will see a few slides from the hospital, and I would like to thank you, Dr. Julwan,
you.
for the time and the presentation
Thank you very much.
and the information given. So thank you very much. Good morning.
Okay. Thank you, Dr. Catherine, for guiding us. And thank you for Dr. Muhammad Julwan Pribadi for sharing the material. Thank you very much for Rumah Sakit Premier Jatinegara. Next, last but not least, we will listen to a presentation from Subang Jaya Medical Center, Malaysia. Dr. Martin Meller Abdullah as a speaker and Mr. Syahrizal as moderator.
Thank you, MC, Dr. Vero.
Hi, Mr. Syahrizal.
Hi.
It's nice to see you.
Yes.
Okay, are you ready?
Assalamualaikum. Yep, I'm ready.
Yeah, okay.
Okay. Assalamualaikum. Good morning and selamat pagi. Especially, first of all, I would like to thank you, the audience, physical and online, to basically log in or attend to this webinar event, because I believe without the audience, this event will be meaningless and not happening. Okay, talking about the event, I'd like to thank our Ramsay Sandabi Healthcare team from the 3 hospital for the effort of having this webinar event, especially the team and technical team from Rumah Sakit Jatinegara. Okay, my name is Syahrizal. I'm the manager for international marketing in Subang Jaya Medical Center, Malaysia. I'll talk a bit of Subang Jaya Medical Center. Subang Jaya Medical Center is an award-winning 444-bed multidisciplinary tertiary hospital, providing comprehensive and complex care in all specialties. Subang Jaya Medical Center is an impeccable reputation as one of Malaysia's most trusted private medical centers, best known for its clinical outcomes. Subang Jaya Medical Center is a JCI, Joint Commission International accredited hospital in Malaysia. Subang Jaya Medical Center also recognized as flagship finalist for flagship medical tourism hospital program hosted by Malaysia Healthcare Tourism Council to establish Malaysia as a globally renowned medical tourism destination. Okay, for today, World Hepatitis Day, in conjunction with World Hepatitis Day, Subang Jaya Medical Center have the opportunity to talk about liver cancer and its treatments available in Sumanjaya Medical Center. I will leave that to the expert, our expert, Dr. Martin Malo Abdullah. Dr. Martin Malo Abdullah is a consultant in clinical oncology and radiotherapy in the Cancer and Radiosurgery Center in Sumanjaya Medical Center. He has experience of 20 years in the oncology field. His expertise includes cancer treatment, image-guided radiation therapy, IGRT, intensity modulated radiation therapy, IMRT, radiation therapy, and stereotactic radiation therapy, SRT. He is skilled in treating breast cancer, terminal illness, and tumors. He's a cool guy as well. Okay, before we start with the webinar, some housekeeping notes to be remembered by the audience. For online audience, any question for Dr. Martin, kindly drop it in the chat box, while the audience at Rumah Sakit Jatinegara maybe can reach out to the Dr. Vero, SJMC, for the question. Okay, without further ado, I will invite Dr. Martin to the Zoom after we see this corporate video from Sumanjaya Medical Center.
Since the day we opened our doors in 1985, we have made it our mission to be a hospital you and your family can rely on, your trusted healthcare provider. Today, we are Ramsay Sime Darby Healthcare's flagship hospital in Malaysia, with an illustrious reputation and years of accolades, offering access to state-of-the-art medical technologies and a capacity of more than 400 beds to accommodate every patient that walks through our doors. Our team of highly trained medical professionals are always ready to provide world-class healthcare at every single stage of your life. Even when it comes to the trials and tribulations of life, you can rest assured knowing that you're in capable hands that will guide and support you. From diagnosis to surgery, to treatment and recovery, we will care for you every step of the way. Even when you're back home into your daily life, we are there to provide the support you need. At SJMC, we're champions of preventive healthcare, and we provide a comprehensive array of diagnostic tests that you can take to arm yourself with knowledge of your own health status. With every milestone you face, we will be there to care for you. Even if you're a family member waiting on news about your loved ones, we have your back. We are dedicated to serving you and your family with the utmost care. Wherever you are, around the clock, and no matter who you are or where you're from, you can trust us with the health of you and your loved ones, because caring for people's health and quality of life is what we do best. We at SJMC are a hospital that grows together with you, and we're here to stay.
Okay, Dr. Martin, the Zoom session is yours.
Thank you very much, Mr. Rizal, for the kind introduction, and good morning, everyone, colleagues, ladies and gentlemen. I'd first like to express my thanks and appreciation to the organizer of this meeting for having invited me to deliver this talk. Can I have my first slide, please? Result the slides.
Technical team, slide.
The first one, please. Yes, thank you very much. So I've been given the task to talk about liver cancer, which I will be referring to as HCC in all my subsequent slides, and the treatment availability in Subang Jaya Medical Center. We have seen the corporate video of Subang Jaya Medical Center, which looks quite impressive with all this aerial view. Next slide, please. Now, managing HCC requires at least these factors to be taken into account. HCC is caused by the underlying causes causing HCC, and the causes can be quite varied. One is also need to understand the effects of the underlying cause, and the cancer on liver function and management of the cancer itself. And with these various factors taken into account, next slide. To effectively manage all these aspects of HCC, it requires expertise of a myriad of experts, namely the gastroenterologists, hepatologists, requires expertise from the radiologists, interventional radiologists, pathologists, liver and hepatobiliary surgeon, nuclear physician, and oncologists as well. And the facilities that needs to be available so that one can seamlessly manage HCC includes the outpatient department, the emergency departments, wards, operation theaters, radiology department, including interventional radiology suites, nuclear medicines, chemotherapy suites, and radiotherapy facilities. Next. To best understand the role that each experts and the facilities play in the management of patient with HCC, it's best that we journey with a patient who present with what might turn out to be HCC. I think Dr. Joe talked about earlier in his presentation, talked about the presenting symptoms that patient may present in a greater detail. Essentially, the symptoms can be very varied depending on the stage of disease, ranging from mild abdominal discomfort to severe jaundice. Clinically, patient may be jaundiced and with enlarged liver and present with ascites. And sometimes they do present as an emergency with ascites that causes difficulty in breathing, and emergency department would be a good conduit for entry into the healthcare. More often than not, symptoms that the patient have can be maybe non-specific, and one of those very glaring symptoms that they have, they may be jaundice, meaning that the eyes can be yellow and the urine can be very dark. And at this point in time, such patient most likely will be seeing a physician or gastroenterologist in the outpatient clinic. So the outpatient clinic is one of the resources that needs to be available in the initial journey of such patients. Next slide. So having seen the gastroenterologist or the hepatologist with signs and symptoms, what may be HCC, the next series of tests requires the input from the laboratory. And SJMC has got a fully functional laboratory, which is ISO certified as well. And what needs to be done then is to check baseline functions, blood counts, liver function, renal function, blood sugar, lipid profile, to understand what may be causing hepatitis, what may be causing HCC in such patients. Hepatitis status, hepatitis B, hepatitis C profiles as outlined in the previous talk. Tumor markers with alpha-fetoprotein is important. And alpha-fetoprotein, I must stress, is not raised in all patients, but probably in about 75% of cases only. The clotting profile with INR or international normalized ratio is also important because this gives us an idea in regards to how the liver is functioning. Next slide. So having done all these tests, the next port of call will be the radiology department and nuclear medicine department. And the kind of scans that are needed includes ultrasound, CT scan, MR, or even a PET CT scan. Now, ultrasound is a good screening test in patients who has got vague complaints, and an ultrasound, on what you can see on the ultrasound there is patients having a mass in the liver. The middle scan is that of a CT scan. You can see some images of lesions in the liver, and the one on your right is the images using the magnetic resonance imaging. Now, there are radiology protocols that needs to be in place in patients who are undergoing the scan with a diagnosis of HCC. And what my understanding is that 4-phase CT scan of the liver is very important to determine the typical pictures of patients with HCC. Next slide. And a PET scan is another scan that's good to determine the extent of the disease, whether it has spread to other parts of the body. The PET scan is not very good anatomically to give you a very exact detailed location of the lesions in the liver. That would be within the realm of the CT scan or the MRI scan. But PET scan will give you an idea whether the disease has spread or not. Now, all these facilities are available in SJMC, in Sriwijaya Medical Center. Next slide. Now, having done the physical examination, the history taking, the blood test results, and the scanning images, one probably will already have a diagnosis of HCC. Now, it's important to remember that the diagnosis of HCC does not necessarily require a biopsy. An alpha-fetoprotein of more than 400 international units per ml with a typical CT scan or typical MRI scan is diagnostic enough for patient to diagnose patient with HCC. However, some patients may present with smaller lesion with low alpha-fetoprotein, as I mentioned early on. Alpha-fetoprotein is raised only in about 75%, and the other percentage, the alpha-fetoprotein may be low. And if there is dubious ideas with regards to the diagnosis, certainly a biopsy can be done. And this is where the interventional radiologists come into play, and we do have such facilities in Sriwijaya Medical Center as well. Next slide. Obviously the pathology, the specimen is sent to the pathologist for us to diagnose this patient with HCC. Next slide. The culmination of all this activity of the history, physical examination, blood test, and scanning would enable us to stage the patient. And the staging system that's commonly used, mostly used worldwide, is the BCLC system, or the Barcelona Clinic Liver Cancer Staging System. And this Barcelona Clinic Liver Cancer Staging System takes into account another score called the Charles-Pugh score, which takes into account bilirubin, serum albumin, INR, ascites, and presence of ascites, and hepatic encephalopathy to come up with a score of ABC. And it basically is a reflection of how severe the liver function is compromised. With regards to the BCLC system itself, there are 5 stages of the 5 stages of disease. Stage 0 is very early disease. It means that the tumor is less than 2 centimeters. Patient's feeling well, meaning that performance status is 0, and your liver is functioning normally, or Charles-Pugh A. Stage A is early disease. That means there is a single tumor of any size, or up to 3 tumor, or less than 3 centimeters. The individual feels well and are physically active, and the liver is also functioning well. Stage B is intermediate stage, where there are many tumors in the liver, but they feel well and the liver is functioning well as well. Stage C is in an advanced stage, where the cancer has spread beyond the confines of the liver to other body parts. Patient may not be feeling well and they're less active. So the performance status is performance status 1 and 2, meaning that they require rest in between physical activities. The liver is still functioning well, meaning the Charles-Pugh score A or B. In stage D, it means that there's severe liver damage, Charles-Pugh C, the individual is not very well, and he requires help in looking after himself or herself. Next slide. So going back to the initial question of HCC, one needs, in order to optimize the outcome of patients being treated with HCC, one needs to treat the underlying cause. Is it hepatitis B, hepatitis C, presence of fatty liver, whether there are any aspects of metabolic syndrome, cholesterol levels, all these aspects needs to be optimally managed to improve the outcome of patients with HCC. The liver effect of the underlying cause and the cancer liver function is also very important, and this falls within the realm of the hepatologist to optimize the function, to delay the deterioration of liver function, and of course, symptom control. Patients with large liver disease tend to have very severe, can have severe pain. And the next aspect, of course, is the cancer stage-dependent management. Next. So HCC, stage 0 to A, or very early to early stage. And as I defined earlier, on stage 0 is lesion less than 2 centimeter, good performance status, Charles Pugh A. Stage A is up to 3 lesions, all less than 3 centimeter, performance status 0, Charles Pugh A or B. And in this group of patients, one should strongly strive to get the hepatobiliary surgeon in the equation to explain, to look at the possibility of doing surgery. Next slide. So this is the patient undergoing liver resection, and the diagram on your right is the schematic illustration of standard hepatic resection that are feasible. So depending on the location of the liver lesion, hepatic resection may be feasible, and in fact may be actually curative. Next slide. If for any reason surgery is contraindicated, either technically speaking or individuals have declined or for other reasons, interventional radiologist comes into play in this scenario. There are 3 modalities of lesion ablation in this situation. The use of pure ethanol injection is one of the modalities that's very effective, but I'm told that the pure ethanol injection is not easy to come by. What is validated as a means of this ablation is radiofrequency ablation. Radiofrequency ablation and microwave are 2 thermal ablative techniques that are available in Sumanjaya Medical Center, and the thermal ablation are generated by different means in RFA and microwave ablation. I've stated the fact that the radiofrequency ablation is the validated modality for ablation, but radiofrequency ablation may not be very effective if the tumor are in the vicinity of large vessels, large blood vessels, due to this phenomenon called the heat sink effect. So maybe in the group of patients in whom the lesions are very close to major blood vessels, microwave ablation may be the preferred choice of ablation. Next slide. Here you can see the group of personnel from the interventional radiologist suite. You can see in their eyes, they're all smiling because they have done a good job in doing their radiofrequency ablation. Next slide. If for whatever reason, these patients with very early to early stage disease are not able to undergo surgery, are not able to undergo ablation, interventional radiologically speaking, we do have an option to consider stereotactic body radiotherapy, in which a very highly focused X-ray, high energy X-ray is focused to treat the lesion. And what you see here is the slices, the axial, coronal, and sagittal slices of liver being treated. And what you see there is a dose gradient where the lesion has been ablated. Next slide. And to do SBRT, it requires very high-end facilities. And in our cancer radiosurgery center, in Sumanjaya Medical Center, we have got state-of-the-art LINAC or true beam, and we also have state-of-the-art Radizac machine, Radizac X9's tomotherapy with synchronous technology. And this allows us to do stereotactic body radiotherapy in a very safe and efficient manner. Next slide. So moving forward, this patient with stage B disease, intermediate stage. In this intermediate stage group, there are many cancers within the liver. Patient's performance status is still good, and the liver function is relatively good. And in this situation where surgery is not feasible, local ablative therapy is not feasible, the treatment of choice is essentially a combination of transarterial chemoembolization and some sort of systemic therapy. Yeah, and what one sees here is essentially the algorithm to decide on how one manages the patient with liver cancer. The diagram on your right depicts the what is called a transarterial chemoembolization. What you see there is that a catheter is placed through the groin veins, and then the catheter is advanced very close to where the tumor is. So the tumor blood vessels, the tumor is supplied by tumor vessels, and the chemotherapy is infused very, very close to where the lesions is. And what we understand from this is that there may be multiple episodes of transarterial chemoembolization that can be done on individuals up to the point where no further transarterial chemoembolization can be done anymore. And in the meantime, the patients are also started on some systemic therapy. Next slide. And the systemic therapy based on this NCCN guideline version for 2022 might include regimens of drug called atezolizumab and bevacizumab, and those drugs require certain precautions. There are certain contraindications to the use of those drugs. Patient with HCC may be prone to bleeding, and therefore those drugs may be used with caution. In situations where those drugs are contraindicated, there are oral therapy that are available. For example, sorafenib and lenvatinib that can be used in conjunction with transarterial chemoembolization. Next slide. So in those who require the therapy that requires infusional treatment, for example, if they are candidates for atezolizumab or bevacizumab, this is where we deliver the treatment. This is the picture of our hematology and oncology daycare. The picture in the middle is the single room in the hematology and oncology daycare services. And the picture on your right are the open spaces in that. It looks very comfortable. Next slide. And in patient with stage 3, which is essentially advanced disease, for patient with performance stages 3 and 4, patients who are unwell, Charles PUC. In this group of patients, palliative and supportive care is the way to go, because any form of intervention with chemotherapy, targeted therapy might actually further deteriorate the liver function and cause death much quicker. And we are fortunate to have two palliative care physicians in our center that would provide the kind of services here. Now, we have not talked about liver transplant. Liver transplantation is a choice treatment in patients with probably stage 0 and stage A, even stage B disease may be feasible to consider transplant. We, however, do not have facilities for liver transplant in SJMC, but in certain select patients who are candidate for liver transplant is a very good choice to achieve. In some centers that does transplant on a regular basis, they can achieve a 5-year survival rate of even as high as 70%. Next slide. So I've tried to stress that the complexity of managing this patient with HCC, taking into account the underlying disease, the effect on the liver. And in an ideal setting, all patients with HCC should be managed and discussed in a multidisciplinary discussion to optimize management of each and every patient, where every expert can have an input. We do have a weekly MDT session booked, but that's just 1 hour, and that's not enough to discuss all the cases that we have got. So more often than not, the multiple teleconferencing between the various specialties occurs, meaning the gastroenterologist or hepatologist would have discussed either with the interventional radiologist or the oncologist with regards to the way to manage those patients. Next slide. So with that, ladies and gentlemen, I would like to thank you for listening. And it's important for me to also express my thanks to the group in Sumanjaya Medical Center from the administrators, the specialists, as well as the facilities that are being accorded by Sukhonjaya Medical Center. Thank you very much for listening.
Okay, thank you, Dr. Martin, for the talk. So for the audience, if you have any question, the online chat box is still open. It's not 24/7, but it's still open. So how about audience at the auditorium, Dr. Vera? Maybe there's a question from the floor as well. Okay, Dr. Martin, while waiting for maybe there's a question for you, I have a question for you. Okay, we're talking about liver cancer. So liver cancer often related to the stigma of being death sentence. People are scared about it, to talk about it. What is the rate of success treatment if the cancer diagnosed at end stage?
Thank you for the question, Shahrizad. Yeah, indeed, liver cancer is indeed a very difficult cancer to manage. And from what I have tried to stress in the talk is that, as with all cancers, the earlier you find the disease, the more comprehensive your treatment can be, and the higher your chance of cure. Essentially, in a patient who has got metastatic disease, i.e. stage 3, stage 4, or i.e. BCLC stage D early on, the outlook is really not very, very good. Treatment that's available, if you remember the guideline by the National Comprehensive Cancer Network, have got guidelines as to what would constitute the optimal treatment to have. But the median survival of patients with advanced cancer like that are measured in terms of months to years, and even years we're talking about between 1 to 2 years. So it is indeed a death sentence, if you like, if somebody has got stage 4 or Duke's or stage C and stage D HCC. So yeah, it is indeed a difficult disease to treat.
Okay, thank you, Dr. Martin. We have one question in the chat box from Fatima, X3. Okay. There's a question for the HCC, especially for C grading. How long do the patient need to take the medication, like sorafenib? What is their lifespan?
Thank you for the question. So the question is, one of the treatment that's used is a medication called sorafenib. This one is a multi-kinase inhibitor. In terms of positioning sorafenib, currently sorafenib is a drug that's given behind. There's another drug called lenvatinib, which is a more preferred choice treatment for patients with HCC, with advanced HCC. Now, sorafenib was the first drug that have shown an increase in the lifespan of patients who were given sorafenib medication. But I must stress also that the life extension that one can generate, one can experience with sorafenib is measured in terms of months only. Yeah. So from the study that was done, the median survival of patients with sorafenib is only about 12 months. Yeah. And if they don't have received sorafenib and just best supportive care, the median survival is between 10 to 11 months. So although sorafenib is a drug that's being used, one has to stress the fact that the life extension that it accords them is only measured in terms of months.
Okay, thank you, Doctor. I believe in the chat box there's a question. Until now, still don't have medicine for HB. Yeah.
HB is hepatitis B, is it? Is it a reference to hepatitis B?
Yes.
Okay. That is a question really that you should be directing to Dr. Julwan, actually. Yeah. My understanding is that for hepatitis B, there are antivirals that are being given, and they're mostly given lifelong. they have to manage the to determine how long they use it. I think they do DNA counts and so on. Now, at this juncture, I think it's important to stress also that hepatitis C is also one of the culprit of liver cancer as well. And I think the hepatologists might agree that at this point in time, hepatitis C can be cured with antiviral. My understanding is that at this point in time, for hepatitis B, there aren't any medication that would cure them. But there are medication, antiviral, that can be given over a long period of time that will control the disease to make it dormant for a long period of time.
Okay, thank you. So antiviral, Mr. Edith. Okay, doctor, I believe this may be our last question. Doctor, how about the prognosis and life expectancy of HC in each stage? It is possible to fully recover if it well treated, especially in early stage.
Yes, indeed. I stress the fact that the outcome of treatment for HCC is very much stage dependent. So stage 0 and stage A, BCLC stage 0 and A, and if they are accorded adequate and comprehensive treatment, the chance of cure is actually substantial. However, the underlying cause of the hepatitis, of the liver cancer also needs to be treated. If the underlying cause is viral infection, the virus needs to be treated enough so that they do not reinfect the liver to cause further deterioration of liver function. If the patient is in stage BCLC stage C and D, really cure is not an expected goal, and the main aim of treatment there is to prolong life, as good a quality of life as possible. And this is where the interaction with the palliative care physician comes into play, because they could decide whether further active intervention could be detrimental to those patients rather than helping them. Thank you.
Okay, thank you, Dr. Martin. Okay, I guess that's all questions today. Thank you, Dr. Martin, again for the talk. And I believe, as per previous talk, I need to share some take-home message with the viewer. Since our topic for this World Hepatitis Day is on liver cancer, the take-home message will be: if the hepatitis advance to liver cancer, don't worry, because there's a way to treat it. There's a place that can treat it. We at Swanjaya Medical Center is a hospital with a comprehensive specialist to manage. Can you say voice? To manage the hepatitis and liver cancer. Okay, before, you can as well in the screen online or at the auditorium, you can see there's some of our promotional ad. Before we end, I'd like to just share a pantun in Bahasa Indonesia, if I can. Okay, dari Kuala Lumpur berlibur ke Jakarta, mampir di warteg minum alpukat. Sepenuh hari Hepatitis Day, semoga webinar ini memberi manfaat. Okay, thank you from us, Sumanjaya Medical Center. Thank you, Dr. Martin. Back to you, Dr. Vera. MC for today. Thank you, Dr. Vera.
Thank you, Mr. Syahrizal. Wow, I get a pantun. Okay, thank you for guiding us, Mr. Syahrizal. And thank you for Dr. Martin Melor Abdullah for sharing us the experience. Before I end this event, I'd like to share our resume from our three presenters today. Fatty liver, where excess fat accumulation in the liver is on the rise globally. This condition may increase the risk of hepatitis and liver cancer. Hepatitis B, the world's most common liver infection, is serious liver infection, highly infectious and can lead to hepatocellular cell carcinoma or HCC. There are several treatment options according to HCC staging: surgical, ablation, transarterial chemoembolization or TACE, chemotherapy, and palliative care. Preventive measures such as a healthy diet, regular exercise, and alcohol moderation are crucial in managing and avoiding potential complications. Also, it's necessary to do annual screening. Although the disease can be treated, please consider a healthy lifestyle is a healthy liver. Thank you to all participants who joined in out to support World Hepatitis Day today. This event hopefully provides a deeper perspective and appreciation of the significance of raising awareness of hepatitis disease. Let us all commit to protecting our health and assisting one another in preventing the spread of hepatitis in our surroundings. Thank you for the entire committee of the event from Rumah Sakit Premier Jatinegara, Ara Damansara Medical Center Malaysia, and Subang Jaya Medical Center Malaysia. Hopefully our collaboration today can continue to the next event. See you again to another opportunity. Waalaikumsalam warahmatullahi wabarakatuh.